Dr. Caudill is a general surgeon at Bronson South Haven Hospital, medical director of Bronson Wound Center and Hyperbaric Medicine, and whether as a general surgeon or working with chronic wound patients, Dr. Caudill is grateful for the opportunity to improve his patients' quality of life. He is on the phone with me now. It's Heart Health Month, Doctor. Good morning.
Good morning, sir. Thanks for the call.
So, this is perplexing. How does heart health affect the feet?
Oh, well, it affects us in a very great way. We'll start out by talking about the heart a little bit. It's an amazing thing. The body in general, the more I learn about, the more amazed I become. The body is just beautifully and wonderfully made. The heart, we'll start with that. It's a pump, one that produces its own electrical activity, which is fascinating itself. It's something you don't think about, but a heart beats about 115,000 times a day, which equates to 42 million times a year, and in an average lifetime up to 3 billion times. It does it without fail in the most part, and what the heart does, it attaches the blood vessels or pipes, as if you want to look at it as plumbing, which essentially it is, and the human body contains normally about 70 to 100,000 miles of blood vessels that carry the blood from the heart throughout the body. And basically what that blood is carrying are nutrients and substances that are vital to healing and maintaining life. And we all know that the body can get along very well for some time without food or water, but without oxygen that's carried by the blood, pumped by the heart, it fails very quickly and cannot be tolerated for more than a few minutes without oxygen. So what we're seeing as that blood is pumped, it goes through larger vessels, the smaller vessels, and then actually reaches the skin. And the skin's what we work with, because wounds basically are when the skin fails and it loses its protective mechanism and the tissue beneath becomes injured. So basically that's what we're looking at, is the heart's ability to provide oxygen to the tissues that we work with. The interesting thing is, the first thing we do when we see a patient in the wound center is we evaluate whether they have enough oxygen to heal that tissue, and there are many ways we do that. And if it does not, anything else we do will fail. No matter what we do, unless we can provide oxygen to that tissue, and the oxygen comes from the lungs to the heart, and the heart very efficiently and without fail mostly pumps that oxygen to the tissues. So that's how it affects it mainly.
So how do you address these things when someone comes to the wound center?
Well, the first thing we do is we measure the blood flow, and we can do that with steps in the clinic itself, but in many instances there are images and x-rays and studies we can obtain that more directly measure levels of flow and pressures, and there are certain parameters we use that allow us to determine if there's enough blood flow to that wound to heal it. Numbers have to be above a certain level, and if that's not the case, then there are ways that can be corrected, and we work very closely with our vascular surgery colleagues to improve that, and we're very grateful for how they help us. So the first thing we have to do is get that corrected, and we measure it and then determine what it would take to improve it. And, of course, the other things we do is talk to the patient about what they can do, and I hope that's what your listeners will take to heart. I'm not upon it, actually, just the way it comes out. But
sure.
They need to take care of their heart. And the things they can do, it's the things they hear constantly. It's smoking. What smoking does, and I think a lot of people will understand this, when you're pumping through a pipe, basically if that pipe becomes smaller, the pressure it takes to get fluid through it becomes greater. And also when you gain weight, and this is a scary statistic, every pound of tissue or fat that you put on will increase the length of blood vessels that the heart has to pump oxygen through by about 7,000 miles. So one needs to think about that when they're sitting down for their large dinners at night, is that if they add a pound of fat, they're making their heart pump that blood through another 7,000 miles of vessels. And what happens is that heart works, it's like any other muscle. The heart's just a muscle. It becomes larger, and that can be of benefit at some time, but what happens, it can become too large to get its own oxygen, and then what And since it can't get oxygen to do what it does, it fails. And we all know what happens then as far as its ability to pump oxygen to the brain and to the tissues and especially to the wound. So smoking, exercise basically decreases the ability to pump, and weight gain is very harmful of the heart. So that's all the thing. We look at it from two ways. We look at it the things we can do and provide to increase the blood flow, and what the patient has to do in their responsibility to take care of their heart and increase and help their wound healing ability. So when they go to the provider, make sure they take their shoes off if they're diabetic, have their feet inspected. Preventing a wound is much better than trying to heal it. If they want to, if they can talk to their primary care provider and get a referral, but we can be reached. They can call us. Just call Bronson South Haven Hospital and ask to speak to the Wound Center. We're glad to take calls and questions about wounds, or they can call at 639-2976, and we'll be glad to talk to them and get them taken care of.